Reese, I believe you're muted.
Good afternoon, everyone. This is Andy Reese with Department of Disability Services. I will start with sharing our data, which is mostly exactly the same as last week, which is good news. So we have had 614 people who've been diagnosed with COVID. We've actually, if you add all these across, had 632 different infections, but that included 18 people who've tested positive twice. 8 of these had their second diagnosis in December 2021, and 8 had a second diagnosis in January of 2022. And there were previously 2 who had been diagnosed 2 times. In the month of February, we had 3 people diagnosed with COVID. 2 of those had been fully vaccinated. 1 with a booster, 1 it was too soon for a booster, and the third person had been vaccinated but had chosen not to get a booster. So by placement type, 1 person in a correctional facility, 14 people in host homes, 126 people in intermediate care facilities, 1 person in a mental health facility, 118 people in natural homes, 2 in nursing homes, 6 in out-of-state placements, 50 in residential habilitation, and 296 in supported living placements. So by placement types, the people in ICFs who've contracted COVID represent a little over 40% of people in ICFs. Of these people, 28 have died. However, there are only 13 that had confirmed COVID deaths, representing a little over 10% of the people in intermediate care facilities who contracted COVID and had a confirmed COVID death. In natural homes, just about 13% of people that we support in natural homes have contracted COVID. Of these, 6 people have died, but it was just 5 confirmed COVID deaths, which represents about 4% of people in natural homes who contracted COVID and had a confirmed COVID death. In residential habilitation placements, a little over 45% of people have contracted COVID. Of these, we've had 3 deaths, but it's just 2 confirmed COVID deaths, representing about 4% of people in residential habilitation who contracted COVID and had a confirmed COVID death. In supported living, a little over 30% of people in supported living have contracted COVID. Of these, we've had 27 deaths, but only 16 are confirmed COVID deaths, representing a little over 5% of people in supported living who contracted COVID and had a confirmed COVID death. So overall, of the people supported by DDA, about 25% have contracted COVID. Of those, 11% have died, but we've had just 38 who've had confirmed COVID deaths, which represent about 6% of people supported by DDA who contracted COVID and had a confirmed COVID death. So in the month of February, we had 3 COVID reports, 3 people supported by DDA who contracted COVID. All 3 were in natural homes. None of the people who contracted COVID in February required inpatient hospitalization. And since the beginning, 144 people who've contracted COVID have required inpatient treatment. Overall, of the people who have contracted COVID, 68 have died. However, 30 of those have been confirmed as non-COVID deaths. which then represents 38 people who have had confirmed COVID deaths. And the most recent confirmed COVID death is in September of 2021. Among our provider staff, fortunately, we've gone another week with no provider staff reporting COVID infections. So that we are at 1,001 provider staff who've tested positive for COVID. 61 of these staff have been reported by more than one provider, and we have had 10 provider staff who have died from COVID-19. Our vaccination rates amongst people supported by DDA, 87% have been vaccinated, 95% of people in host homes, 99% of people in ICFs, 77% of people in natural homes, 100% of people in residential habilitation, and 93% of people in supported living. For people supported who have gotten boosters, 70% of people who are eligible have gotten their booster. And we continue to work with providers and the people we support to move that number up. Amongst provider staff, 96%, which is the same for DDS staff, which it says updated 224, but I got that confirmed late yesterday that it is still 96% of DDS staff and 96% of provider staff have been vaccinated. As a reminder, we will begin tracking booster rates, tracking whether provider staff are fully vaccinated with our report in 2 weeks. And that's the same date on which the city government is beginning to enforce the requirement that all staff be fully vaccinated. As people, I believe, are aware, we had talked about this before. There was a regulation. So initially there was a regulation from DC Health that all of our staff who come in contact with the folks we support are required to be vaccinated. That regulation was updated recently to include that staff should be fully vaccinated, which means if you are due, you must have a booster. I know that some folks, including the Provider Coalition, but maybe others as well, joined in a letter to DC Health to ask that March 1 deadline be delayed until March 31st. DC Health's response was that they would not begin enforcement of that until April. The regulation itself, however, is in effect beginning March 1st, but DC Health has said that any enforcement that they take would not begin until April 1st to allow for time. As we've said, within DDS, the enforcement mechanism is our provider certification reviews. And so our provider certification reviews that occur in March will include a review of whether staff are currently vaccinated, which would include for people who are required to have a booster, whether they have that booster. As we've said, so just for clarity, I think it's really helpful for people in the letter that Dr. Nesbitt had written to the Provider Coalition. She referenced CMS guidance regarding the vaccination, the requirement to have the vaccination. And what I think is very helpful in this guidance is that CMS, much like what we have said for DDS, that their focus is the importance of people being um, up to date with vaccinations, especially people who are working in these health settings where there's where they could be coming into contact with vulnerable populations, and that the focus of this um, is to ensure that everyone is fully vaccinated. There are a number of enforcement remedies that are available, more so to DC Health, quite frankly, than to DDS. But the focus will be when you find that provider staff are not yet fully vaccinated, to work with them on a corrective action plan to identify ways to get their staff up to a level that they are fully vaccinated. Like some of the provider groups that the CMS requirement applies to, um, the only real remedy for us is that you get to a place where the provider um, puts at risk their Medicaid provider agreement. But there are a lot of steps before you get there. Most importantly and immediately would be a corrective action plan, identifying what the issue is, identifying ways to resolve the issue. It is essential that staff who work with people um, be fully vaccinated. And so, to the extent staff do not have a waiver from DC Health, or are still pending that waiver, they must be fully vaccinated. And so, we have, I think, 5 agencies that have their PCR reviews this month. And so part of that review will be whether people are current with their vaccinations. And as I said, the focus is then going to be on, if they're not current, working with the provider to come up with a plan for how they can be current. And so someone has asked, excuse me, is there going to be providence for exemption for those religious reasons or medical reasons? So if a person has a sincerely held religious belief that prevents them from being able to be vaccinated, which has been, well, I was going to say which has been approved by DC Health. It has to be approved by DC Health if they state that they have a sincerely held religious belief that prevents them from getting the vaccination, or if they have a medical reason that prevents them from getting the vaccination, they seek a waiver from DC Health. Until that waiver is denied, they can continue without their vaccination. Once the waiver is denied, at that point, then the person would have to be vaccinated um, consistent with the regulation. So I wanted to provide one other update for folks. The Metropolitan Washington, sorry, Council of Governments um, is required by Housing and Urban Development to have a regional housing equity plan. And this plan needs to address the effectiveness of fair housing throughout the metropolitan area, including the district. So the Department of Housing and Community Development, excuse me, will be pulling together a focus group, a virtual focus group, and they are asking for people to participate. This focus group will look at fair housing for people with disabilities in Washington, D.C. It's occurring on Thursday, March 10th from 3 to 4:30. And I am going to put the link, I hope. Ah, I'm going to put the link in When I put the link in just now, it just said click here. There we go. So there is the link, as well as the Council of Governments website, where you can also get more information about this forum. So you go to this link to pre-register. And, I think that providing input about the importance of affordable, accessible housing in the district is important to many of the people who are here. So if people are able to attend again, I have put the title and the date and time of that meeting in the chat for people. And they are interested in hearing about housing discrimination, eviction, or substandard housing conditions. I think as the region considers the issues, though, information about the availability of accessible, affordable housing in the region is important input as well. And from what I've seen, I haven't seen what their cap in terms of the numbers is for people attending. So people may want to register soon, depending on how many people their Zoom call can manage. But I think they are particularly interested in hearing from community members who are actually and directly affected by this. So people may have also noticed that DC Health, if you're like me and you check the coronavirus.dc.gov website regularly, daily, to see the status of sort of where we are in dealing with the pandemic in the district. They have changed in the key metrics how they report the information to be consistent with the most recent guidance from the CDC, which has now classified the district as in terms of current COVID community level is low. And the way that this is determined is a combination of the COVID cases per 100,000 over the past 7 days in a jurisdiction, as well as the capacity of the healthcare system to manage these cases. So for jurisdictions that have fewer than 200 per 100,000 over a 7-day period, if they have new COVID admissions to the hospital, or the percentage of staffed inpatient beds occupied by COVID-19 at under 10%, that's low. If it's between 10 and 19.9, it's medium, and over 20 is high. The district, by these new definitions, wonderful. So Nelson can chime in and provide some clarification about these changes and how this affects how we're doing things in the district.
Thank you, Director Reese. I know that with the release of this new community level tool and the fact that the COVID tracker has not been retired and is still into effect has caused some confusion among our providers, specifically when it comes to guidance where levels of community transmission determine whether or not you wear eye protection, etc. And I would like to clarify that this new community level tool is only for the public, and it does not affect any of those guidance that relate to what healthcare providers or healthcare workers should do related to PPE or anything else that references the COVID tracker tool. Even though the new community level tool shows us in low, and I haven't looked this morning, but I believe that according to the tracker, we are still in substantial transmission. As Director Reese was saying, both of those tools calculate differently. The community tool is really more of a level of what the burden is of COVID in the community and less specific to transmission in the community. And so they're measuring two different things. At this time, the CDC and DC Health is not changing recommendations that refer to the COVID tracker. So if there are guidance rather that refers to the COVID tracker, you should continue to use that level of COVID transmission to determine what level of precautions you should be taking and things like that. So I hope that provides some clarification. I believe there is going to be a letter that is going out to healthcare facilities and also providers that better states this clarification. And I believe that DDS will also be included in that, but I will make sure. So.
And I assume the COVID tracker you're referring to is the CDC COVID tracker?
That's correct. Yep.
Which is the one that you have referred people to all along in terms of the guidance that's provided for the guidance of healthcare providers, right?
That's correct. The link is included in those guidances. If for some reason those links stop working, please let us know and we will make sure that those get fixed. But to my knowledge, they all still work, and that is the level that you should use when determining those things that it refers to.
So what all of these things remind me of is that we, I've not heard yet. The federal public health emergency is still in place. Um, I have not yet heard anything official about whether it will be extended. It's currently expiring in March. Um, we've gotten some heads up about where they're heading, but no official word as yet. But as a reminder to people, in terms of our Appendix K and the flexibilities that are allowed for our service provision, those can continue until 6 months after the end of the public health emergency, the federal public health emergency. So if that were to end in March, we would be talking until September. If it were continued, I think those get continued in 90-day increments. So if it were continued until July, then the provisions in our Appendix K would then continue until January of 2023. The very important thing about this I think is that we need to remember back to 2020 when everyone very quickly pivoted and began, and then we also made some changes to allow for people to provide um, companion services in residences for everyone. However, companion services are intended only for people in particular circumstances. And so once the Appendix K ends, so does the flexibility to be providing companion services to everyone. And what that means is we really need to be starting now to plan together about what it looks like after the public health emergency to be helping people. I know that, I mean, the numbers are way down. We have some folks who have um, transitioned back into some day services, significantly fewer than we had pre-pandemic. But what we need to be doing is helping people move toward what does your engagement in the community look like as we exit the Appendix K and the public health emergency. 6 months after we're out of the public health emergency and no longer have those flexibilities, how do we help people to be engaging back in the community? Um, and so we are going to next week be contacting folks to pull back together the group of people that worked with us as we were planning our return today in the summer of 2020, um, and the people that came up with the CPAC. And I'm trying to remember what it stands for. That's terrible. But at any rate, this is about re-engaging people in the community. And so we will pull that group back together and really talk about how do we handle that transition back into the community. Because I think for everyone here who teleworked and worked from home and has since or is planning to transition back to an office setting, there's an adjustment period. And so we need to be thinking with the people we support about how to manage that adjustment period and how to begin now with managing that adjustment period. So we will be discussing early next week and reaching out to people so that we can pull folks together to really look at having a working group of how do we begin that transition because it's not going to be something that we can um, transition from one day to the next. It was essential in March of 2020 that from one day to the next, we all transitioned to staying at home. We did find, I think many people have found, the transition to working at home was an easier transition for people than the transition to coming back to the office. And so, we really need to talk together about how we do this and how we support people through that process. Someone's raising a really important point. So it is March is Developmental Disabilities Awareness Month. And on the first day of Developmental Disabilities Awareness Month, the DC Council had second reading on the DD expansion bill, and it was passed. And so this will now come to the mayor for signature, and we will keep you posted on that. And then after the mayor, it then has to transmit to Congress, and it has congressional review, which is a 30 congressional day review. And then it becomes the law. So thank you to folks who worked together on this bill, and we will keep people posted as we track this moving forward. Kind of in line with all of this, the mayor's budget is due to be out on March the 16th, and the DDS and the ODR budget hearings are on March the 22nd at noon. We will devote the time during this forum on March the 18th to discuss the DDS budget, assuming that all the facts I just stated remain true in 2 weeks. But I expect that to be true, and that the mayor's budget will be out on the 16th. People will have public access to it, and we will be able to share the specifics related to DDS on March 18th, so that people can be well informed and be able to testify on March 22nd. Okay, it seems that we don't have any other questions from people. It became winter again today, but this weekend is supposed to be like a beautiful spring weekend. So I hope that everyone enjoys their weekend. And we will talk again next week. Thank you very much.